The concept of supplemental oxygen can be overwhelming and confusing. We are here to help you navigate all the features. Shortness of breath is not triggered necessarily by low oxygen. In COPD, one of the major problems is not being able to fully exhale. The air gets trapped and the lungs become overinflated, creating a sensation of shortness of breath. The diaphragm is pushed down and the lung mechanics are impaired. This also adds to the sensation of shortness of breath. The gas exchange of oxygen and carbon dioxide takes place at our alveoli with the blood capillary system. Oxygen is a gas. Oxygen accounts for approximately 21% of the gas in the air we breathe. The rest of the air around us is comprised of approximately 79% oxygen. Every cell in the body needs oxygen to live. Oxygen is transported through the airways of the lungs to the alveoli. Alveoli are the air sacs at the end of the airways in the lungs. It is at this point where the oxygen and carbon dioxide are exchanged between the lungs and the blood. From the alveoli, oxygen is delivered to the blood and brought to the cells of our body. Oxygen cannot be stored in the body. Therefore, supplemental oxygen will be prescribed if the lungs cannot deliver adequate oxygen to the body's cells. Issues faced by you are that more people are discharged to their home on oxygen as hospital stays are shorter these days. Many of these people are healthier and active and more informed than in the past. And thus, it is most important to understand that the goal of oxygen therapy is to maintain appropriate oxygen saturation with levels in all activity. Products in the home are different than those that were used in the hospital. Economic pressures are impacting therapy decisions, such as insurance reimbursement, co-pays. Limitations will exist in changing providers and/or systems once one is started on an oxygen system with a particular company. Do you have an interest in monitoring your oxygen saturation at home with an oximeter? Many people have found this to be helpful. And how do people continue to have a good quality of life with oxygen? You will go on to see, as we talk about many oxygen devices, that this certainly is a high possibility. One question many people have is, how do I know I need oxygen? Need is determined by measuring the amount of oxygen in your body using an arterial blood gas and/or a pulse oximetry. Hypoxemia, low oxygen in the blood, or hypoxia, low oxygen saturation, are the factors determining the need for supplemental oxygen. Dyspnea, which is the sensation of breathlessness, is not a reliable way of determining if you need oxygen. Oxygen is not necessarily given to treat dyspnea. Dyspnea may be due to other causes. Medicare insurance guidelines require that oxygen saturation levels measured by pulse oximetry be 88% or below, so a desaturation on room air for the cost of an oxygen prescription to be covered. The goal of oxygen is to ensure adequate oxygenation and saturation at all times. This includes while at rest, with our activities, during sleep, and any time we may be in a different altitude. How much oxygen one should have is another great question. The quantity, which is the flow or setting of oxygen, is also determined by the arterial blood gas test and/or your pulse oximetry. The goal is to keep your oxygen saturation level above 90% or 88 to 89% by some physicians. Some physicians may be okay with lower levels for short periods of time. Too little oxygen in our blood over time deprives the cells in the body of oxygen and can result in problems such as memory loss or damage to your heart, which are two major organs. Other major organs may also be affected, such as our kidneys and our liver. Oxygen is a prescription drug and should be used as directed by your physician and/or your provider. The prescription will include settings and when to use the oxygen. It may be possible for some people to get too much supplemental oxygen if they happen to be a carbon dioxide retainer. You may be wondering how many hours a day you will need oxygen. Determinations are made for the amount of oxygen you will need at sleep, rest, and with exertion. In some cases, oxygen may be needed 24 hours a day. During exercise, you use more energy and therefore your body demands more oxygen. A walk test is done to determine how much oxygen is needed with exercise or exertion. It is important that the test be performed while using the type of delivery device that is going to be used in the home. The immediate benefits of using oxygen with exercise may include relief of breathlessness and improvement in your ability to walk or do activities. Oxygen may be needed while you sleep also. It is true that more shallow breathing occurs while sleeping. In some cases, people that may not require oxygen while awake may require oxygen while they sleep. Determination is made with a sleep study done as an outpatient in a sleep clinic, or sometimes a limited version may be done in your own home. A sleep study may also determine that you might need CPAP or BiPAP for sleep because of conditions such as sleep apnea. Home oxygen products consist of the following. Compressed oxygen gas is oxygen at about 99% purity that is stored in pressurized tanks. Oxygen concentrators take in room air, remove nitrogen from it, and provide about 90 to 95% pure oxygen. These run on electricity or are battery powered. Stationary concentrators plug into the wall and they run on electricity. Portable options may include tanks or portable oxygen concentrators or liquid. Stationary concentrator with home fill enables the user to fill the portable tanks from home with their stationary concentrator. Portable oxygen concentrators run on battery for longer portable options. These frequently can be recharged by plugging into an electrical outlet or a vehicle charging outlet. Liquid oxygen is oxygen stored in a liquid form in insulated containers. Flow delivery options for supplemental oxygen include continuous flow, which is a flow that is set at predetermined flow rates in liters per minute. This is determined by resting and walking oximetry testing and is written as a prescription by your physician. Pulse dose flow includes fixed pulse, which is the same pulse volume delivered per breath. As the breath rate increases, minute volume of oxygen increases. Or minute volume delivery, where pulse volume varies with respiratory rate. As breath rate increases, volume per pulse decreases. Some safety precautions with oxygen in your home are: do not smoke near oxygen. Stay away from open flames while wearing your oxygen. Do not store oxygen near water heaters or furnaces. Oxygen cylinders need to be secured and placed in an area where they will not fall, as cylinders are under high pressure. There should be good ventilation around your oxygen equipment. Oxygen concentrators can generate heat, so they should be kept in a more open area. Here we highlight some safety precautions with portable oxygen. You should have carts for oxygen tanks. Over-the-counter bags for tanks are also available. And breathable mesh bags for portable oxygen concentrators are also available, either through your DME or on different websites. There are always many questions around travel and oxygen. It is safe to travel with oxygen. You should plan your trip in advance and contact your oxygen provider well ahead of time to find the system that works best for your travel needs. If traveling by air, portable oxygen concentrators are required. There are pulse dose or continuous flow systems that can be used. Battery life is important while traveling by air, so you need to estimate battery life that's necessary, multiplying your flight length by 1.5 to 2.5 times. You do not have to use the contracted oxygen provider that the airline works with. You should be able to use your current provider, or they will assist you in finding a provider that can supply the device you need. Some important facts about air travel include that partial pressure of oxygen in the atmosphere at sea level is 21%. The cabin of an airplane is pressurized to 8,000 to 10,000 feet. Oxygen density in a pressurized airplane is about 30% less than at sea level. An individual using supplemental oxygen would likely need to increase their flow or setting when traveling by air. An individual whose oxygen levels are borderline at sea level may need supplemental oxygen for air travel. Airlines and cruise ships and trains require a prescription from your physician before they will allow you to travel with oxygen. Some airlines may have a form that is particular to their airline that has to be completed by your physician and submitted to the airline prior to the day of travel. Check with your airline for all requirements. It is advisable to obtain a letter from your physician specifying your diagnosis, need for oxygen, and all oxygen settings. Include with this a list of your medications and contact information for your prescribing physician. The details around how oxygen is paid for can be complex. Your oxygen provider will receive payment for 36 months for rental of your equipment. Your oxygen provider is responsible for 60 months of supplies, disposables, maintenance, and service of the equipment provided to you. Because of these rules, providers have limitations when switching to newer equipment. The rules also result in limitations if you are considering switching to another oxygen provider. At the end of your 60-month contract, you will need to requalify and sign a new 60-month contract with your provider or a new provider. To requalify, this means that you will require a new oxygen saturation test and a new prescription from your physician. Medicare regulations state that your oxygen supplier may not change the type of oxygen you receive without first obtaining a new letter of necessity from your physician and your approval. If your supplier tells you they are no longer supplying the type of equipment or modality that you require, they must find another supplier who can furnish it, and if they can't, they must continue supplying it to you. The supplier may not change the number of compressed tanks you receive without first consulting with your doctor and yourself. You may call the COPD information line at the number listed here and provide the information on your particular case. They will then instruct you on how to file a complaint directly with Medicare. There is a lot of product variability amongst oxygen systems. We often get asked, why can't I have a small one? Oxygen devices vary. There are pressurized gas tanks, liquid, stationary concentrators, and portable concentrators. The size of the tank and the size of the motor in the portable concentrator may vary. Different devices will also have differing performance characteristics. These include bolus volumes versus continuous flow, the sensitivity of the unit, and the response times of the unit. All of these factors are relevant, and your provider will be familiar with the different devices. In a portable oxygen concentrator, the smaller the device, the smaller the motor, and thus less oxygen the device is capable of producing. Smaller tank sizes contain less oxygen and will deliver for shorter periods of time. Some home oxygen options include stationary concentrators and gas tanks. Stationary concentrators require additional systems for mobility. A stationary concentrator might also increase the electrical costs that you notice on your bill. These devices do make noise when they run. Gas tanks do vary in their size, the duration that they will last, the number, and the storage. Even though liquid oxygen is not an option for many people, there are some pros and cons to know about. They are both stationary and portable. You can get a large in-house stationary unit, and then you have smaller units that you will fill from that large unit. The filling times are relatively quick. You can fill your own portable unit, which is nice. They are stored at -362 degrees Fahrenheit, and thus the portable tanks can freeze up and close when you are trying to refill them. Liquid oxygen does evaporate, so even though the device itself might have liquid in it, over time it will empty itself out. Home-filled devices are popular options for many people. You can see you have a stationary concentrator which provides oxygen for you in your home. You have a second compressor attached to the top of that for filling your tanks, as shown in the photos here. As you can see here, there are a variety of oxygen cylinder sizes available. The duration of your oxygen cylinder depends upon the flow rate for which you are using. Here you can see some portable oxygen concentrator systems. These are greater than 10 pounds. Some considerations amongst them would be maximum oxygen production, the dose delivery per setting, the trigger sensitivity, are you able to sleep with the unit, the weight of the unit, and the battery life. Here are examples of portable oxygen concentrators that weigh less than 10 pounds. Some considerations are, most of them are not able to be used while sleeping. You also want to know about the trigger sensitivity, the dose delivery per the setting, the purity of the oxygen, the weight, and the battery life. Here are some portable oxygen concentrator purchase and rental price estimates from around the Twin City area. Durable medical equipment companies include Allina Health, Apria Healthcare, Fairview Home Medical, Lincare, Rotech, Corner Home Medical, Handy Medical Supply, Liberty Oxygen and Home Care, Northwest Respiratory, Reliable Medical Supply, and Ridgeview. If you are having difficulty accessing oxygen as prescribed, please report that issue directly to the COPD information line. You may also contact Medicare directly. It is important to be knowledgeable about oxygen systems, especially if you are considering purchasing a unit. Oftentimes, advertising can be deceiving. Let us know if you have any further questions.